Hello everybody and welcome to the Tuesday edition of Video Clips, and we are getting plenty of pledges in on the Stop Talking, Start Doing project. And of course, because we're in the healthcare business, it's oriented toward changing your habits and getting informed and making better decisions and exercising and things like that. But another aspect of Stop Talking and Start Doing has to do with just the way you're living your life. And this is, I was already doing the exercise and diet thing well, but I've changed some things since the beginning of the year or the end of last year. In response to this, I've bought gifts for friends for no reason, just because I saw something that I thought the person would like. I bought symphony tickets, and I've scheduled nights out with friends and events, and I'm fixing up my house and cleaning things out, and I'm just, things I look at and I think, one of these days I'm going to get to that. One of these days I'm going to go to that. One of these days I'm going to do something like that. And I've stopped talking about it and I've started doing it, and it's fun. It is fun, and it makes you feel good, and the more of it you do, the more you'll want to do. So, since many of you are in need of accelerating the health improvement type behavior, I know if you start doing it, you'll do more of it. So let's all do this together this year, all right? So if you want to sign the pledge, send me an email, pampopper@msn.com. I'll email one to you, and you can stop talking and start doing. New courses. I've got 10 new ones this year. First one up is vaccines, which starts in the middle of February, so now's the time to sign up. One thing, we have some wonderful packages that go with membership if you want to take a number of courses from us, so send me an email about that. And then I'll remind everybody of all the new benefits that go with membership. Office hours with Eileen, and regular Ask the Therapist sessions, conversations with Pam. Learn and Earn. We're going to actually pay people to show up for classes and give them credits toward courses that they want to take. I mean, some of these courses are priced so that you could actually earn a free course by just doing this. So again, send me an email and you can participate regardless of where you are in the world. We have members in dozens of countries. Doesn't matter if you have access to Skype or a phone or a computer, you're in, all right? And last but not least, if you're thinking about a career in healthcare or you're in healthcare and you'd like to be doing something different, more along the line of what we're doing, send me an email, pampopper@msn.com, and let's do something about it. Let's stop talking, start doing, and get you on the way to a great new career. Doing something like what I do. I love it every day. You can be productive, help people in meaningful ways, and there's so much opportunity because people are so unhappy with the healthcare system right now. Stop talking, start doing. Send me an email, pampopper@msn.com. So I had a conversation with a client before I get to the main topic today that I thought was interesting. I'm going to pass it on to you. And it had to do with supplements. And a lot of people coming in here have been to see alternative practitioners, and they're taking dozens sometimes of supplements, or most of the time they don't even know what they're for, and most of the time they haven't noticed any difference from taking them, and that's accurate because most of the time they're pretty useless. There are good applications for them. I want to be clear. It's not all or nothing, because I think that, I've said this many times, the real good space to be in healthcare is where you're looking at everything individually. Does this benefit you for what you're trying to do and what your issues are? But so anyway, somebody came in the office and we were having a discussion about supplements, and the person said to me, I take them sometimes, I don't take them sometimes, I don't know, I'm just having trouble quitting. And I said, well, I think what it is I grew up in an era where we were brainwashed to think that supplements were a good insurance policy. Nobody was talking about deficient diets at that point in time, and we don't have deficient diets in this country, by the way. When did you ever see somebody who has scurvy or beriberi, for example? It's ridiculous, but anyway, we grew up in a culture at my age where we were told, take supplements for insurance in case you're missing something in your diet. Worst case scenario, you get kind of expensive urine. I used to buy supplements all the time, and they were always different depending on who sold them to me, and I would take them for a while and not take them for a while. But it's a hard habit to give up because the brainwashing about the value of them has been so significant and over such a long period of time. And I think that's part of the difficulty with supplements. It's just the same thing with medical care. It's hard to give up something that you were invested in for such a long period of time. And I had this difficulty too. I tell people it's like peeling an onion. Every time you think you've gotten to the core, the inside, and you're done, there's another layer to peel off in terms of changing belief systems about things. So I think it's true about supplements, and I also think it's true about the greater picture of healthcare. Really arriving at the conclusion where you need to change things in a major way and maybe not be so trusting about healthcare. It's a big decision. It's hard to make, and I totally get that. All right, so for today's topic, we're going to talk about hypertension. And I'll just start by saying the financial burden of hypertension in the United States is over $53 billion, with a B, dollars a year. It's the single most important risk factor for cardiovascular mortality, more significant than all other risk factors for women and all others except smoking for men. Drugs are commonly prescribed to treat hypertension, but many of them are ineffective, and some increase the risk of cardiac events, and they all cause side effects, and some of them are quite serious. So, for example, a Cochrane review concluded that evidence does not support the use of beta blockers like atenolol as first-line treatment of hypertension because it has a minimal effect on reducing the risk of an event. Calcium channel blockers like amlodipine increase the risk of dying of cardiovascular disease and cancer. Gosh, that doesn't sound like such a good plan. And angiotensin receptor blockers such as losartan do lower blood pressure but increase the risk of heart attack. Again, not so good. So there are really good reasons to seek better ways to lower blood pressure. Of course, I don't think you'll find this surprising. Diet, exercise, weight loss are all effective, and when used together, even more effective for lowering blood pressure. And according to a new study, mindfulness meditation can successfully lower blood pressure and have a positive effect on habits relating to hypertension risk. And I wanted to cover this particular study for a variety of reasons, which I'll come back to at the end of this. So let's start with what is mindfulness meditation. It's a practice that focuses on emotions and thoughts and sensations through breathing, mental imagery, and awareness of body and mind. Practitioners learn how to stay focused on the present, not let their minds wander so much, and to quiet disruptive and distressing thoughts. Benefits include lowered stress and anxiety and positive changes in physical health. The study that I found that caused me to make this clip included 48 patients. They were an average age of 69, most of whom were taking drugs for hypertension when the study began. And so what the researchers did is they took the mindfulness-based stress reduction protocol and adapted it for this particular study. And what they came up with was 10 classes that covered education about hypertension and its risk factors, information about diet, physical activity, alcohol consumption, stress, social support, and behavior change. Patients also learned skills such as meditation, yoga, attention control, and emotional regulation. At 1 year, patients with stage 2 uncontrolled hypertension, which was defined as systolic pressure at 140 or higher, experienced an average 15-point drop in blood pressure. The patients also showed improvement in things like self-awareness, attention, and emotional regulation. Changes were dose-dependent. Patients who spent an average of 18 hours a week outside of their classes practicing mindfulness had an average of a 15-point drop in blood pressure at 3 months and 11-point drop at a year. On the other hand, those who just went to the classes and they didn't do anything else, their blood pressure only dropped 4 points at 3 months and 6 at a year. So it was definitely dose-dependent response. The more you did, the better off you were. Now, what I found interesting is the feedback from patients who were participants in the study. They said things like, he sort of walks and lives his talk. I always felt no matter what you said or how you said it, he listened, he'd process it. Supportive learning deepens the learning in a non-judgmental, supportive fashion. When he brought up things to illustrate points, he would bring in personal anecdotes which supported participants' understanding of the modules and impacted their willingness to implement intervention training. One participant added, quote, "That was a big influence on me and how I can follow this practice in order to lower my blood pressure." So in other words, an instructor who modeled healthy behaviors, listened to patients, used personal anecdotes to deepen understanding, made people feel like they could do it. They could implement the program and lower their blood pressure. They felt empowered. Patients also noted that they had contact information like emails and phone numbers that facilitated asking for assistance, that the program was well organized, it started on time, and they also noted that the food was good. And we've always felt here that serving good food would make people fall in love with eating healthy food more than just talking about the health benefits of healthy food. They stated that they felt that being part of a community of people who had the same issue, hypertension, was helpful, as was group discussion and help with goal setting. Mindfulness training is very inexpensive. It's not invasive. It's non-toxic. It can be practiced at home, and it has a positive effect on so many different physiological and psychological conditions. It has the breadth of effect is pretty amazing. It should be used more often in healthcare practices. Additionally, I think this study, and this comes to why I wanted to cover it, in addition to the fact that this works, this study shows the importance of spending time with patients, of using structured programs, of providing support via group and individual counseling, and emphasizing diet and lifestyle change and improving health. More of that, less drugging, and the world would be a much better place. All right, if you're not a subscriber, hit the subscriber button. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you on Thursday with more news.